Okay, I'm gonna walk you through what pilonidal cyst recovery typically looks like, from symptoms and treatment, options to healing, wound care, and prevention. I'm a registered nurse, and I'm just talking through this casually, the same way I explain it to my patients. This is just going to be a general overview meant to explain how this condition behaves and what recovery often involves. A pilonidal cyst forms in the crease near the tailbone, near your butt crack. This area is exposed to pressure, friction, moisture, and movement, which makes it more vulnerable to irritation and infection. Inside the cyst, hair, skin, cells, and bacteria become trapped beneath the skin. Over time, this can lead to inflammation, swelling, pain, and sometimes drainage. Pilonidal cysts are common and they are not caused by poor hygiene. Symptoms can vary quite a bit. Some people notice mild discomfort or pressure at first. Others develop pain or swelling more suddenly. Symptoms often change over time. Pain may improve and then flare again. Drainage can appear suddenly or gradually. These changes don't always follow a straight or predictable pattern. Drainage can bring temporary relief from pressure, but it doesn't necessarily mean the cyst has healed completely. Treatment depends on how severe symptoms are and how the cyst behaves over time. Some cysts are monitored, others require drainage if infection develops. In some cases, surgical treatment is recommended, especially when the cysts recur or don't heal well with other approaches. There isn't one single treatment that works for everybody. Different providers may recommend different options based on symptoms, history, and response to treatment. Healing after drainage or surgery usually happens gradually. Pain often improves over time rather than disappearing all at once. Drainage may continue during healing. Sitting and pressure on the area commonly affect comfort, especially early on. These patterns are common during recovery. And wound care at home depends on how the cyst was treated. Some wounds are packed and some are not. Dressings may need to be changed regularly. Gentle care and skin protection help support healing. Comfort during recovery often depends on reducing pressure on the area. Sitting positions, clothing choices, and frequent position changes can make a difference. While many symptoms are normal during healing, some changes should be evaluated. If you got worsening pain, spreading redness, fever, or foul-smelling drainage, that should prompt a call to your provider. Pilonidal cysts can recur because the area continues to experience pressure, friction, and moisture. Okay, so prevention focuses on reducing irritation in a realistic, sustainable way rather than extreme rigid rules. This video is a general overview. If you want a step-by-step guide that covers recovery, wound care, red flags, and the long-term prevention in more detail, my full Pilonidal cyst recovery guide is available and linked below or in my bio. It's designed as a practical reference you can return to during recovery.